There was also picketing outside Essentia's new facility in Duluth today. And not just nurses. More than 700 members of USW Local 9460 are employed across the Essentia system, but their contract with the hospital expired July 1st. Northern News Now's Rob Coles heard from union reps and hospital leaders about negotiations.
Members of USW Local 9460 may be getting plenty of support from drivers on 2nd Street, but negotiating a labor contract is no easy task.
I think there is a little bit of frustration on our part, right? We understand where they're coming from and why they want to do the things that they want to do, but when we bring up our concerns and the reasons why we have those concerns, it feels like they're not understanding us.
The union held an informational picket Friday, raising concerns about staffing at Essentia Health. Local 9460 members perform many jobs at the hospital, including technician work for radiology, laboratory, respiratory, and behavioral health. But their ability to hold a variety of positions is a matter at the center of negotiations, flexible scheduling.
A lot of their proposals revolve around flex and floating, being able to reassign people to different departments, different facilities.
According to union president Tun Vu, moving people to different positions frequently doesn't provide the best care for patients.
So if someone's being pulled into do an assignment that they haven't been proficient in or haven't been practicing, we think that's a concern.
While union members continue to picket outside on 2nd Street, inside the hospital, leaders are welcoming members of the public to come and tour their new facility.
We respect their right to conduct informational picketing. Our focus really today is on showcasing the new St. Mary's Medical Center.
According to Essentia's Louis St. George, hospital leaders are working to address staffing concerns.
So we're always looking to create, have creative staffing solutions so that we can respond to the needs of our patients and patients' illness levels.
But all sides may have to come together to find a solution.
We can't do anything by ourselves, so it has to be mutually agreed upon by us and by the colleague, by the employee.
In Duluth, Rob Coles, Northern News Now.
The negotiations between the hospital and Local 9460 began in May. Staffing has been the main concern. Discussions about pay have not started yet.